Because it's a fine line where you potentially are repositioning and restoring versus changing someone's appearance. It could be millimeters that you can change appearance.
3 weeks, a month after the surgery, I was actually sitting with my buddies at the golf course. Nobody said anything. Of course, I saw the difference because I had it before.
Were you hoping they would say something?
It was interesting. But in some ways, yes, but in a lot of ways, no.
The entire movement of society to work from home a lot has made it a boom in plastic surgery just because of the recovery. People can still get back to work quickly. Who elected to undergo a deep plane facelift in his, how old are you?
67, 68 years old.
Which is it?
I think it's 68. Yeah, it is. It's 68.
Hi, everyone. Welcome back to another episode of UnFiltered. Today, we're very fortunate to have a patient of ours who's participating in our podcast, who is I'd say a professional athlete, but he can tell you more about it, who elected to undergo a deep plane facelift in his, how old are you?
67, 68 years old.
Which is it?
I think it's 68. Yeah, it is. It's 68.
All right, so we have the privilege of having an interview with our patient who's in his later 60s, male. We haven't done a male facelift, and we're going to dive into some of the nuances surgically, some of the considerations of the patient, timing, and just an open discussion about deep plane facelift in a male patient. I'll let Nancy start.
Well, I'm very excited to have Sean here because he's evolved into being one of my favorite patients. We hit it off right from day one. And we've talked many times about the female facelift, and I'm excited to have him here to talk about the male facelift. It's a little bit different because it's not as, I would say, socially acceptable, or amongst men, they don't often seek out a facelift. It wouldn't be their go-to procedure, where we see a lot more women. So, Sean, tell us, when Dr. Solomon says professional athlete, you were a professional
correct. Yeah,
ballet dancer.
Yeah, I was a ballet dancer. Started my training pretty young. Went to the National Ballet School for 8 years, starting at 10. Graduated at 18. Was 9 years in the National Ballet Company. Got married, settled down. Figured, well, ballet dancers were not like hockey players making millions of dollars. So I thought I better look at something else to get into. Friend of mine's father said, why don't you open a dance studio? So I did. It turned out to be very successful. And 43 years of running that. And then I retired. And, I was feeling like maybe something just to make me feel, vital, good, and looking at just to get maybe that confidence back as I was starting to feel older. And started to do a little bit of research on what can I do to make me feel a little bit better. And so this is how I ended up looking at a facelift for men, which is, you're right, it's not necessarily a common thing that I think most men would look at. Right?
Let's show what you looked like before when we first met. So this photo on the right here is the profile of Sean when we first met, and this is him after. So when you came to chat about a facelift, were you open to other procedures, or were you mostly wanting to focus on the neck and the jawline?
What I was seeing in the mirror was really, I was sort of manifested on what was happening to my neck. The jawline, the lower face was a little bit of it, but it was mostly the neck. And I golf a lot, and with my older buddies, I'm the youngest guy in my foursome. And I was just sort of seeing what age was doing to them. And again, with the career that I had, and also looking to get back into maybe something to do with the dance industry, but more on a management side, it's sort of looked at to be something where useful. I don't know if I want to say that, but just sort of that fresh vigor approach. And I was sort of feeling like I just needed something to freshen me up. And it seemed like for what I was looking for, a facelift was going to be the answer, not just a peel or something like that, or just better skincare for myself. So that's when I started to do sort of the research and looking into it. Yeah.
So you wanted to look like your best self. You didn't want to look 30 years younger. You wanted to look like masculine, natural, and age appropriate.
I wanted something that was very natural.
Yeah.
And where, my buddies weren't going to say, what the heck did you do? That sort of thing. And when I was reading a lot of reviews and things of, from people, and mostly women, but some men that had a facelift done. The thing with the men, it was they talked about how it looked very natural, right? And that's why I also, when I started to do some research, went to the deep plane procedure, because it seemed like something that you didn't look pulled, you looked more natural, a little bit longer healing time, but longevity to the results. In other words, it lasts longer. But again, it had that natural look. You didn't look like pulled like some of the old facelifts.
So let's talk about the technique and what the differences are between the male facelift and the female facelift. So I know the incision is different. So let's start with the incision around the ear.
Yeah, for sure. So the incision is different. It depends on what surgeon you go to, but in general terms, the incision for a male facelift has to take into consideration that males have hair-bearing skin on their sideburns. And so you have to factor in that you don't want to move the hair-bearing skin posteriorly in towards the ear. So in female facelifts, we may hug the tragus, but in males, we often go just in front of that where the hair-bearing and the non-hair-bearing skin meet. Frequently, you'll see in patients, especially if they're in their 60s, a natural line or wrinkle that forms in that area due to some redundancy of the soft tissues. And we usually look for that natural line. Sometimes it's a straight line. Sometimes it could be a line that has a little jog in it just to follow the wrinkles. But basically, that's the biggest difference in terms of the incision and placement. Then we follow it up into the hairline. The key is we don't want to sort of move the sideburn up, or same with the females, you don't want to move your hairline posteriorly too much, because that can be a giveaway of a facelift. In the old days, many people tried or were mostly obsessed with hiding the scar. So going into the hair was ideal to hide the scar. But we found that patients, especially those that had higher hairlines or people who had multiple facelifts over time, started to have their hairline moving posteriorly because hair-bearing skin kept getting removed. So we try to follow the natural sideburn where you wear your hair now, or make sure that we're not going to modify your hairline significantly with the facelift. Yeah, that's basically it. That's the biggest difference.
That's the only difference.
That's the biggest distinction in terms of the surgical approach and the incisions. There's some other technical considerations, just which are artistic in nature, evaluating the patient's soft tissues, the architecture of their face, where fat would be placed, if fat grafting were to be considered, because it's a fine line where you potentially are repositioning and restoring versus changing someone's appearance. It could be millimeters that you can change appearance. Now on the internet, we see, there's always these celebrity speculations of them having stuff done. I think Bradley Cooper's been popping up on my feed all week, and people are speculating that he may have had an upper blepharoplasty. And for someone like him, even the most subtle changes can change the way he looks, potentially obviously to improve his looks and reverse aging process, but sometimes can make you look a little different, which for a celebrity who's got facial, recognized look to them, can potentially not be good for their career.
So did that with Renee Zellweger. She looks significantly different.
Yeah, there's tons and tons of examples. On the Bradley Cooper one, I think he's obviously a handsome guy. He's a superstar and an amazing actor, but even the most subtle thing of a couple millimeters of differences of the upper lid. And you can look at some of the pictures, and I'm not even sure if he had surgery, but on the images that are being posted, it seemed to sort of feminize his face a little bit. So feminization of the face on a masculine-looking man, like we wanted to keep you looking youthful, but manly and rugged. We don't want to make you look pretty or overly done or overly pulled.
Do you pull as tight on a man as you do a woman?
I think it's case-by-case basis. We're not really pulling so much on the skin. We're working specifically on the deeper structures and repositioning them. And then we're trimming the skin under almost no tension. So at the end of the operation, the skin just sits where we want it to sit in a more favorable position with less of the redundancy that you have with the aging process. So patients think tight, but tight's not necessarily what you want. Tight can be a giveaway that it doesn't look natural. And specifically in a male, looking overly tight or pulled. Another example would be Michael Douglas, who had a facelift probably 20 years ago. He's older now. And he was, a Hollywood celebrity and a superstar, and his looks obviously helped in his career. But post-facelift, he looked really quite done, I think, around his eyes, and he looked quite tight along the jawline, neck, and seemed to change even the commissure of his mouth. And that's likely attributed, and again, I'm just speculating, to some of the older surgical techniques that were being used at that time.
For myself, what I'd like to share was I actually wanted it to be very natural. There was like 3 weeks, a month after the surgery, I was actually sitting with my buddies at the golf course. Nobody said anything. Of course, I saw the difference because I had the before.
Were you hoping they would say something?
It was interesting. It was, in some ways, yes, but in a lot of ways, no. It was actually a family friend that came over and said, "Sean, what did you do? You look 10 years younger, right?" And I said, "Oh, I just did a face peel or something, right?" I didn't actually say what it was. But with my buddies, who I see 4 times a week, they said nothing because it wasn't really a vanity thing why I did this. I just wanting to be, again, with what I did for a living, to be my best self, right? And looking at going into a little bit different business, still having that sort of fresh and, just feeling vital and a little younger. Yeah, I guess just, but it really wasn't a vanity thing. But when I went, I'll actually say this, I went and interviewed 3 surgeons, of course, Dr. Solomon being one of them. And I'm not a surgeon or a doctor, but I tried to understand the difference in the different procedures. I felt I felt a really good connection with Dr. Solomon. I felt that his just, sort of telling me about different sutures and that the process I thought was very good for me to understand it. It wasn't overly technical, but it wasn't under explaining. And there was a situation where Dr. Solomon had to go and take care of a situation. Not really a situation. There was somebody that needed his attention. So my first interview was cut a little bit short, but the gentleman called me later on that day, actually called me and was concerned that I have all my questions answered. And that to me showed somebody that really did care because we had just met. And the other surgeons, again, very well known. But I just felt that there was a little bit more of a personal touch to the way he, after one meeting, just was sort of took that interest that, was I comfortable? Did I get the answers that I needed? And after looking at 400, reviews from different people, there's always somebody that's not happy. But I just felt generally I was just getting a very good vibe about what he represented with his work. And when he was saying, to make it look very natural, I didn't want to look pulled or anything like that. I did want something very natural that didn't change the basic look of who I am. Yeah, so that's why I chose this young man.
The topic of men versus women in facelift surgery. So women, it's expected and normalized in society that they do everything they can to stay looking beautiful and youthful. Surgery is fine. Non-surgical procedures are fine. Doing body work is all accepted. It's not as accepted or normalized for men to do the same. Why is that?
I think it's a huge topic. Probably we could analyze it for hours. I'm sure people have. But I think there's just societal differences in expectations of people. So I think there's a premium on female beauty that's just built into society, whereas men are historically just viewed as the provider and to provide security and potentially some finances. Obviously, that's not the way it is anymore, but those were the sort of basis for it. And I think some of those old-fashioned concepts may have lingered behind, that we put a premium on female appearance and a premium on male competency, we could say. So now it's become much more blended, and there's obviously women are judged by competency and everything, how good a mother they are if they have kids, how good an executive they are if they're working in industry, how good looking they are. And it can become a double-edged sword. So it becomes a whole melting pot and mosaic, I think, to analyze. But I think those are probably some of the core historical reasons, in my opinion. So I think that men, generally speaking, and I do think there's some cultural differences to this, and I don't want to get into it in too much depth, but I've had my own observations where you see certain cultures where you see stunning women who've done everything to maintain their beauty, and they may come in with a husband who's done zero to maintain his beauty, whether it be even exercising, working out. The guy could have a big gut and not care about how he's even presenting or what he's wearing. The woman could be decked in designer stuff with everything from head to toe. So there's obviously a different value add of what the person's bringing to the relationship and where they want to invest their energy. So I think that's all changed, obviously, as we're moving forward, and probably will continue. We're on the evolution of that change. But I think that probably impacts how men are perceived differently if they start embracing aesthetics as an important thing to them. But
now we are seeing a lot more men. I find this past year alone, we've seen a lot more males having facelifts.
100%. I was
Yeah.
going to add one other layer to it is likely socioeconomic. So the two hurdles to do aesthetic surgery, and I guess in men there may be three, but the two hurdles for females is fear and finances. And in men, there's going to be fear, potentially finances, and third F could be that it's frowned upon. If I had to make up another F, so there's a different hurdle of it being frowned upon. So I think, and if you're in a higher socioeconomic class, then the finance piece may be irrelevant. The frowned upon may be less of a negative because it may be more commonplace within that socioeconomic group. But if you're looking at a blue collar worker whose primary role is to provide for his family and to put food on the table and shelter, it may be frowned upon and maybe just viewed differently within that group. So I think those are all the layers that I would sort of give thought to. I haven't really processed it all. I'm just sort of coming up with stuff at the top of my head as we're sort of talking about it. But I think those are kind of the way I would perceive it. And you know, someone like you're more open-minded. You're coming from like an arts background, a sports background where your physicality was important, your appearance was important. And then finally, you add in how we see ourselves way more now. In 2025, we're seeing ourselves on phones and photos. There's billions of pictures taking of, selfies. In the 1960s, 70s, 80s, none of that existed. So people didn't see themselves as much. So they just weren't as aware of the aging process unless they went and had a family event and took some family photos. So I think that plays into it as well.
I think our culture today is much more, as you're saying, visual in everything. Because it's right in front of us. It's, as you said, it's right in our own phones and everything else. And when you talked about a blue collar person, definitely in that sort of economic sort of whatever the right word is for that, it might be more frowned upon. Whereas somebody who's an executive out there, much more representing a company, representing themselves in that company as a leader, then how people perceive you and how people look at you is something that if you have that confidence inside as that leader and that man or woman in an industry, it just helps you, again, be your best self. It's not necessarily a vanity thing. There's also a professional side to it. Whereas depending on where you were, let's say that more of a, and again, being careful with how I say this, a working class or blue collar person, that might be perceived as more vanity and maybe frowned upon, or something that they wouldn't necessarily do or share with family, whatever.
I'm going to simplify it a little bit. I think men just want to look natural. They don't want to look like they've had cosmetic surgery. When I talk to the different men that I meet, whether it's the husband of a patient the wife is all dolled up because she's done a few procedures, and the man is starting to feel like, I'm looking a little bit worn and torn. Maybe I should do something as well. He's now got a little bit of an insight into what the industry is like and what the results look like, and that he can look natural, and his wife looks beautiful. Maybe I'll do something as well. We do see that. And I think men are wanting to look good. I just think men are now seeing all the women around them, whoever is in their life, maybe be looking good, and they just want to look good too. We are definitely on our phones and scrolling through, and we can go back 5 years in 5 seconds to see what we looked like 5 years ago, and we are seeing ourselves age, and we're just more aware.
Yeah, I think just aware. Culturally, it's just things have changed. That it is, thank goodness, more acceptable, as you said, for a man to feel that he's all that he can be, his woman, his wife, whatever this relationship is all that she can be. And together they can feel, very good about themselves and maybe even more balanced in the relationship. Because you're right, it does happen where women are just more comfortable with going and searching and finding and getting certain procedures done that will help them feel that their best self.
So how did you know a facelift for a man existed? What was your, your path to research?
Well, as Dr. Solomon had mentioned, you can see it just in you're watching films, right? And you say, oh, gee, I mean, so and so, my God, that actor is, in their 60s and they look like they're in their 40s, right? And so it's very aware that they are doing this as part of their career, part of what they do. And then you sort of start to think, well, gee, they're looking great, and just fresh and vital and that sort of thing. And maybe that could be something that I might do a little bit of research on so that I can feel that good about myself.
Was it a male or a female that sparked the thought?
Well, it's obvious that you see it in the females.
Yeah.
You see it in the Kardashians. You see, you see a lot of that, and like, my God, that person looks fantastic. But it was more in some of the male actors that I'm seeing saying, yeah, and James Bond or this or some of these that are playing very masculine roles and yet look fantastic in their 60s. And then I was looking at my age and I thought, let me start doing a little bit of research on this. And again, it wasn't a vanity thing. I think it was more about just feeling my best self.
For those of you who are listening to us, I suggest you go to our YouTube channel and take a look at what Sean looks like, because he is really a fantastic example of looking natural, looking refreshed, looking age appropriate and masculine. Really,
Thank you.
Yeah, you look fantastic. You did a great job.
You did. And
pat on the back.
I go back to my buddies. They're like, we're all watching the hockey game and this and that. They're the point I'm trying to get across is that I would have thought, because I'm with these guys for 20 years, 30 years, right? And I was sure one of them was going to say, all right, what did you do? Nothing.
That's amazing.
And this was like 4 weeks, barely, when I just had to get out of the house and it was time. So that was my litmus test, and nothing. They were like, yeah, hey, how about that game the other night? It was nothing. And we're like sitting
because you look the same. You look the same, but the part that was bothering you, the jawline and the neck, that's missing. So it's not an obvious thing when people don't see what was bothering you, because they're not looking at you the same as you're looking at yourself.
And that's the thing that Dr. Solomon kept saying. We want you to look natural. And, we can achieve this, we can achieve that. And my expectations were realistic, but I really felt that he did better than my expectations, because, again, everything that I wanted done got done. But it really was to maintain who I am and something that's very natural. So when my buddies didn't notice it, that to me was like, okay, home run.
I'll say just one last thing. We're closing up.
I was going to say, what do you suggest how he maintains his results? Or is it a one and done and he doesn't have to do much more? What do you think? What do you suggest?
Well, the aging process is endless. I mean, so we continue to go through the aging process. I think the facelift is sort of a foundational reset, but again, everyone ages differently. We do occasionally go in and do little extra nips and tucks. I mean, we don't want to unless we actually feel like we have to. Some patients feel that they have a little bit of laxity even after the facelift over about a 1 year period. Sometimes we go back and just do a minimal incision at the back. Sometimes we're able to take a little bit more skin and tighten up the neck a little, but hopefully we don't need to do any of those. There are some non-surgical devices that we use in our clinic for maintenance, such as microneedling radiofrequency, other energy devices, which sometimes are, and lasers sometimes are helpful just to maintain your skin quality and keep you looking youthful. Regular use of Botox for the upper third of the face is a nice thing just to maintain and avoid developing crow's feet and some of the deeper lines. But again, we're very conservative on males with non-surgical treatments. And the last thing I was going to say was just that while surgical treatment can seem the most scary for many patients, it often does provide the most natural results. So we do see patients who've relied on non-surgical treatments. And this is not a bash at non-surgical treatments because we provide them as well in our clinic. But there is a point in time when surgery is indicated. And if you're relying on only the non-surgical treatments like fillers and things like that, sometimes you can start creating changes in someone's appearance which look odd or weird. So we see people coming in and saying, I don't want to look like so-and-so because they look like they had bad plastic surgery. And then I'll look at who they're talking about, like a celebrity often, and I'll say, I don't think they had any surgery. I think they just had tons of filler. And in a male in particular, you can end up looking really like distorted with tons of filler in the cheeks and things like that. So I usually tell men, if you're going to do anything, do a surgical intervention in your middle age and up rather than non-surgical treatments, because I feel like the non-surgical treatments, if you rely exclusively on them, can change your appearance. Well, that was the other point you mentioned is worth repeating, which is the entire movement of society to work from home a lot has made it a boom in plastic surgery just because of the recovery. People can still get back to work quickly, but work remotely. So in the old days, people had to show up at work quicker. So I think it's definitely made it easier and accessible for patients to find time to do the procedures. That's good. I hope you guys enjoyed that. I think we covered a lot of material in a short period of time and gave you a sense of what it's like to undergo this type of procedure, and just want to thank you once again for participating.
Thank you very much.
It was very, very helpful and nice of you.
I'm flattered. My pleasure.
And,
I'm glad I could help.
And thanks for choosing me and putting your trust in me for your surgery. And I'm thankful that you're thrilled with the outcome. And want to thank the listeners for tuning in, and see you all soon at our next episode of UnPhiltered.